Migao mar thieth ma Siaya komakore gi migao mok mar piny owacho AMREF tiego nyimreche to gi jochiw thieth mamoko e weche mag tuoche mag non-communicable diseases kaka tuo sukari, tuo nindo, kwiri mar thuol to gi mamoko. AMREF bende dhi chiwo gik tich ma konyo e pimo tuochego endo.
Called Charles Odur. I coordinate neglected tropical diseases in Siaya County. Siaya County government partnership with the AMREF to reduce the prevalence of neglected tropical diseases. We have several neglected tropical diseases in Siaya. Just to name few: snake bites, dog bites, and jiggers. We also have schistosomiasis and soil transmitted helminths, which are just worms. So right now, AMREF is in the county and is doing a lot of capacity building. It's also doing a lot of trainings. Like right now, last week, we trained CHAS, and next week we are going to train community health promoters. So we are going to train them so that they are able to pick these cases from the community, and you know that when we will be creating demand, because they are going to pick these cases and they'll refer them to the facilities. And now they are also going to give us equipments, several equipments used in the hospital and also in the laboratory, and even some used by gynecologists, so that we are able to pick these neglected tropical diseases. There are some neglected tropical diseases that cause serious health problem to the community, like for example schistosomiasis. You would find that it can affect the liver, the kidney, and even it can predispose people to cancer of the cervix and even cancer of the bladder. So the coloscope that is going to be brought will help us diagnose the cases early, and then we treat them. Because what is good with the neglected tropical diseases, they are treatable, and these are low-lying fruits which can be treated very easily using very simple drugs. For example, the schistosomiasis, we just use praziquantel, and worms, we can either use mebendazole or albendazole, and even jiggers is very easy to manage. So these diseases, we have a target that by the year 2030, we should be able to eliminate a good number. In fact, at the moment we are collecting data in Rwambwa and Madiani, so that we can declare Kenya as a country free of sleeping sickness.
My name is Robert Ofwete. I work for AMREF Health Africa, the NTD program, and we are here today in Siaya, specifically in Lagos Songa. We just done with a planning meeting with the sub-county committee focal persons and the sub-county NTD coordinators for the entire county. Last week we trained all the CHAS, around 200 and over 200, and this week we're going to train the entire population of CHPs, over 2,000. And the essence and the objective is to strengthen the community health strategies, so then they can be able to mainstream and take up NTD activities in the community. These actually follows training for the healthcare workers, where last year we sat down with the CHMT, and we did conduct TOTs for healthcare workers with regards to diagnosis, that is the laboratory personnel, where we're taking them through diagnosis of the entities that are endemic in this region, as well as the pharmacists, as well as the health records officers and other cadres of the clinicians. After that, that was cascaded to the facilities. Now, this helped in mainstreaming reporting. Right now, we have been able to mainstream reporting for entities in the national platforms, such as the KHIS, the Electronic Community Health Information System, that the ECHIS, and right now we're also looking at mainstreaming and integrating within the EMR. So integration has been happening, and that's why we're actually taking it down to the community. Remember, entities are mainly preventive and promotive diseases. So for it to be successful, someone has to come out of the community and seek medical care, and even the community health promoters, they have to have a suspicion index that is high enough to be able to suspect some of these diseases. And so we are not only focused on the facility level, rather at the facility level, but also the community.
Okay, my name is Judy Onyango. I'm the sub-county NTD coordinator for Game Sub-County. So basically what we do it both in the facilities that we support and the community. So in the facilities, we do detection, that is from the clinicians, suspicion of these neglected tropical diseases, and then diagnosis at the lab, and then of course we treat the pharmacy. So there's also the reporting part of it, which includes the HRIOs, those are the data people, to ensure that all these diseases that have been reported are entered into the KHIS. And then in the community, so far we've done the mass drug administration to cover, first of we did the general population, and then the over below 15 years for soil transmitted helminths, that is the worms, and then for bilharzia, or also known as schistosomiasis.